Hello, my name is Adil.
And my name is Mike. We are students in the CDA program at Camosun College.
Welcome to the 2021 IDE Festival. Our presentation is influenced by a recent lecture at the 2021 Pacific Dental Conference presented by Cornelia Cohn, titled Brave New World, a Quick Start Guide to Implementing Teledentistry Today.
Today, we are going to discuss a new trend in the practice of dentistry, the use of teledentistry. Let's begin by defining this term. Teledentistry is the use of telecommunication technology to communicate remotely with patients and other dental professionals. This technology has been in limited use since 1994. The COVID-19 pandemic has pushed the utility of this technology to the forefront of dentistry.
COVID-19 has created a new risk for the spread of disease through the direct contact with other people. The implementation of the teledentistry can help mitigate the risk of disease exposure by establishing remote contact with patients and colleagues. Any reduction in the amount of time spent in face-to-face contact with others will increase the safety of healthcare professionals and their patients, while still providing ongoing care essential to the maintenance of general health.
A recent study published in the Journal of the American Dental Association concluded that 5 out of the 7 professions at higher risk for contracting COVID-19 are related to dentistry. These include CDAs, hygienists, general dentists, dental lab technicians, and dental specialists.
Remote contact using teledentistry will allow us to greatly reduce the exposure risk to both ourselves and our patients, while still allowing us to provide quality care to our clients. Many patients have postponed dental treatment and routine care which are essential to their general health for fear of contracting this COVID-19 in our offices. It's essential that ongoing care is maintained despite the current pandemic situation.
Dentistry is an inherently risky profession with respect to disease transmission because we are constantly exposed to the microbial load found in the oral cavity of even healthy patients. Conventional methods employed to reduce this risk include
the use of PPE, such as gloves, masks, protective eyewear, and gowns.
Administrative controls, altering the manner in which dental staff carry out their duties. For example, an office administrator can work remotely using their home computer. This eliminates one person from having to be present in the dental office and so reduces the risk to everyone in that office.
Engineering controls. Minimize the number of the staff members in an operatory at any time. Rather than having a CD and a hygienist in a room with the patient at the same time, allow each care provider to carry out their tasks one at a time wherever possible. Minimize the number of people in the same room reduces the risk of disease exposure.
Substitution. Implementing alternative treatment techniques wherever possible using protocols which reduce the risk of disease transmission. For example, a hygienist can avoid aerosol production by performing hand scaling on patients as opposed to ultrasonic scaling. This is not always possible in dentistry. For example, there is no alternative technique for the installation of an implant abutment other than physically drilling a hole into the alveolar bone.
Elimination. Physically remove the risk hazard during the treatment of the patient. This, where teledentistry can play a role in mitigating the risk of disease exposure by allowing a patient to interact with the dental staff from a remote location wherever possible.
The first 4 methods discussed above reduce but do not eliminate the risk of disease transmission. Teledentistry is the most practical method for ensuring the safety of patients and staff and should be implemented whenever possible.
There are 2 different forms of teledentistry. One is relatively novel, the other is more conventional and is already in broad use as a part of patient treatment.
Synchronous teledentistry. This involves a real-time interaction with a patient, lab technician, or referring specialist using a video link.
Asynchronous teledentistry. The transmission of digital images and written notes to all members of the dental team for the purpose of diagnosis and treatment planning. For example, sending radiographs from general dentist to a periodontist allows for both members of the team to assess information required for the treatment design.
The implementation of teledentistry protocols can be a daunting task. Most of us do not like change, but the current COVID-19 pandemic has forced us to think differently about how we provide care. The following is a checklist designed by Cornelia Cohn that will act as a guide to setting up teledentistry in your office.
1. Compliance. Because you will interacting with patients and colleagues remotely, a situation may arise where the people involved reside in different jurisdictions. For example, a dentist in BC may be treating a patient who lives in Alberta. Consideration must be given to cross-jurisdictional differences in regulations for treatment that may exist. Similarly, patient insurance and dental malpractice insurance may be confounded by providing treatment across provincial borders. Federal regulators must provide oversight that will account for cross-jurisdictional difference in regulations. The U.S. has moved in this direction. Canada appears to be currently lacking in any discussion of this issue.
2. Security. Teledentistry, either synchronous or asynchronous, involves the transfer of personal patient information. The security of this information is paramount to maintaining the legal right of patients to confidentiality. Do not engage in a teleconference with a patient using social media which is not secure, for example, Facebook Live. Be sure that your office is using software specifically designed for the safe and secure transfer of personal medical information. Mouthwatch Teledent and Rhinogram are but 2 examples of specifically designed software for dentistry.
3. Equipment. We must design protocols to guide the patient on how to take intraoral photographs from their home, which can then be sent to your office to help in a diagnosis. This will mean one less visit to the office for the patient, thus reducing risk of disease transfer. Cornelia Cohn has established specific instructions for their patients, guiding them to take diagnostic photos using a smartphone and a flashlight. The instructions provided are specific to every region of the oral cavity. In-office equipment for teledentistry includes an external artificial light source which integrates with a smartphone and can create high-resolution digital images that can be used for diagnosis and for sending information to specialists to aid in treatment planning. MDP is a US-based company who has designed just such a piece of technology specifically for dentistry.
4. SOPs, or Standard Operating Procedures. Ensure that your office has developed specific protocols to perform teledentistry that will be applied consistently from patient to patient. Examples of protocols to be considered include:
Who will you treat via teledentistry? Only existing patient with a pre-existing chart? Can you use teledentistry for new patients?
How will you schedule multi-appointment treatments when some of the appointments could be done remotely?
Standardized forms. For example, you can electronically send a consent form and medical history questionnaires to a patient and have them fill the forms out at home.
Payments for treatments can be set up remotely.
Here are few specific examples where teledentistry will be useful in minimizing direct contact between patients and dental professionals, thus reducing the risk of disease transmission during the pandemic. The ultimate goal is to reduce face-to-face contact wherever possible.
1. Initial consultations with patients can be done remotely, using both synchronous and asynchronous methods, to establish a diagnosis and design a treatment plan.
The dentist can assess whether a dental emergency is indeed so by discussing the situation with the patient from their home. The dentist can determine if the patient must come to the office immediately or if treatment can wait. This form of remote triage will reduce contact with the patient.
Follow-up treatments may be done remotely, meaning one less visit to the office for the patient. For example, the dentist can assess the extent of post-surgical healing without an office visit.
Treatment consultation with dental lab technicians and specialists can be carried out remotely using both synchronous and asynchronous methods, eliminating the need for face-to-face discussions between the dental team members.
In summary, COVID-19 has provided an opportunity for the dental profession to embrace new technology that can improve the safety and provide increased convenience for our patients. Teledentistry could become the new normal in a post-pandemic world.
For example, patients who live in remote areas and must travel to an urban center for dental care are subject to inconvenience and expense related to travel. This is especially true of patients undergoing treatment, which requires multiple appointments. Some of these appointments, such as the initial consultation and follow-up care, can be done from the patient's home, greatly reducing the stress and inconvenience from traveling on multiple occasions to complete treatment.
Thank you for listening to our podcast. This is CDA students Adil and Mike. Oh, it was running.
Thank you for...
Thank you for listening to our podcast. This is CDA students Adil and Mike.